For almost 60 years, Frank's been the rock on the block. The guy who's always been solid and strong for others. But lately, he's been losing his grip on his own life and his struggle with alcohol and marijuana. He lost his job, and losing his family may be next. Just as everything was coming apart, his doctor told him about a proven talk therapy called Cognitive Behavioral Therapy, or CBT, for substance use disorders. Frank wasn't much of a talker, but old Dr. Stevens never steered him wrong before, so he agreed to give it a try. At the start of treatment, Frank and his therapist, Kim, set specific goals to work toward in treatment. First, they focused on helping Frank manage urges to drink and smoke. Frank learned urges usually have a trigger, like specific people or situations. For Frank, triggers included receiving negative feedback at work, arguing with his wife, and hanging out at the bar with Charlie, who's had a buzz on for the last 20 years at least. Frank learned to avoid his triggers when possible, like Charlie in the bar for sure. Kim and Frank then put together a coping plan for when Frank has an urge. Leave the situation, distract himself with something to do, call someone he trusts, and definitely reward himself for following his plan. Next, Frank learned something key, that what we think affects how we feel, which then drives our behaviors or actions. Frank often thinks he's not good enough, which makes him feel down. Then he reaches for a drink or smoke. But by spotting this pattern, Frank can catch and change these thoughts and break this chain. Frank also discovered it was hard to turn down a drink or smoke. Kim taught him assertive communication skills so that when he said no, it would land like one of his overhand rights, no two ways about it. In the last part of treatment, Frank worked on creating and improving positive relationships and weeding out friendships based on drinking and smoking. Frank's wife, Ruth, even joined a couple of sessions to learn how she could best support Frank as he made changes. They also learned ways to communicate better. They're feeling closer than they have in years. Dancing isn't so different from boxing after all. After 3 months in treatment, things are turning around. No drinking or smoking in 5 weeks. Though he has tough moments, Frank's more confident managing his urges, and slowing down his thinking has improved his mood. Oh, and one of Frank's new buddies helped line up an interview with that woodworking shop down on Belmont. Frank's golden years may be golden after all. If you have problems like Frank and want to make real changes in your life, there is effective help available. Get started on a new path at treatmentworksforvets.org.